We're a prescription-based therapeutic because women aren't willing to address it. They need to understand that it's a medical condition and no fault of their own. And under their clinician's care, they can get better. The American College of Obstetrics and Gynecology and the American Urogyn Society and the American Association of Family Practice all recommend screening for urinary incontinence starting at age 18. So it's not the little ladies about to go into a nursing home. It's 18-year-old ballerinas. This is going to take you through how your pelvic floor actually works, understand how those muscles are engaged, and then, let's talk about a treatment because you don't have to live this way.
Welcome to the Game-Changing Women of Healthcare, a podcast featuring exceptional women making an impact in healthcare today. We celebrate our guests' accomplishments, setbacks, and the lessons they've learned throughout their careers. We dig into the many healthcare issues we face today and how these innovative leaders are working to solve them. I'm Meg Escobosa. Join me in conversation with some of the many brilliant, courageous women on the front lines of the future of health. Hello, everyone. Today, we're very fortunate to be speaking with Eileen Maus. Eileen is the Chief Executive Officer of Renovia, a woman-led digital therapeutics company addressing women's pelvic floor disorders. She was brought into the role just over a year ago with 20 years of experience in healthcare. In our conversation, we will hear about leva, Renovia's award-winning femtech product. Eileen developed a passion for women's health at SciTech Corporation, now Hologic, where she was the vice president of commercial operations of the surgical division, and she contributed to its growth from $8 million to $700 million. Eileen also served as chief commercial officer for Constitutional Medical Investors, a portfolio company of Warburg Pincus. She received her Bachelor of Science degree from LaSalle University in Philadelphia. She is also one of Healthcare Technology Report's top women leaders in medical devices. Hello, Eileen. Thank you so much for joining us today.
Meg, thank you. And I appreciate your podcast. I've been listening to the original episodes and, I'm 57, so I think I'm a little bit older than some of the guests that you've had on the show. And when I was coming up, I didn't have tools and resources like this. I have two daughters. They think the world is their oyster. I think about how far we've come, since I started in the business world, and just such a gift for the young ladies coming up today to have the resources at their disposal to kind of model their careers after and kind of understand some of the challenges in front of them.
Thank you so much for saying that. That really means a lot. That's awesome. I also have two daughters, so I absolutely think of them when I am thinking about these stories and making it more clear what is possible and what it takes, because it has been sort of mysterious when you are sitting on the sidelines or out of the industry or not in the working world yet. So thank you so much. I'm thrilled to hear that. Can you tell us a little bit about your background and how you got to your current role as CEO of Renovia?
Meg, I think if some of my original teachers in high school and college had heard that intro, they would say you're talking about the wrong person. I come from two women's healthcare, primarily being one of four girls in my family, PhDs and doctors all around. And I was always the connector. I just like to understand what's going on and what's the view of the world. Probably not the most academic student. I was just more curious about everything else that was going on around me. And at that time, you say, oh, maybe I should have buckled down on my studies more. But I really think it was observing what was going on around me that led me to the career I'm at today. I've always been a real hard worker. I've just got to be passionate about what I'm working. Geometry wasn't what I was passionate about, right? I don't know if you ever read John Maxwell.
No.
He writes great leadership books. And something that really connected to me is he once said, the closer you are to your passion, the more intuitive it is.
Oh, that's great. Yeah.
That just really connected to me. And I've always been drawn to, I understand it. I think I can take it to the next step. I think this is where I'm meant to contribute to society, because I really do believe we all have gifts. And some people, it takes a lifetime to uncover. I got into women's health and I just said, this is where I'm meant to be. And I know that's not great career guidance, but I think when you're in your wheelhouse, it's not that it's not hard. It's not that it gets easier. It's the time flows differently.
Would you mind sharing just some of those early days? Like, what were some of the projects that you worked on, some of the initiatives that you were part of that were inspiring or at least kind of keeping you engaged in women's health?
Well, I came into healthcare being a pharmaceutical rep. And I worked with various specialties, neurology, cardiology, OBGYN. And my appeal to women's healthcare was just that the OBGYNs, I just felt like were the doctors that connected most to their patients. And the fact that it was a lifetime relationship. And a lot of times it's a happy relationship. And I was just drawn to that. I'm drawn to health and nutrition and exercise. It's just, how do you make things better? How do you live your best quality of life? And that's what I felt like OBGYNs were trying to do. I launched 2 products when I was with Cytec that you'll know the names to this day. One was the ThinPrep Pap test. And when you go for your cervical cancer screening, you're going to get ThinPrep. And believe me when I tell you, there were many dark days that the fact that ThinPrep would be a standard of care didn't seem like it was ever going to happen. And then we acquired a company called NovaSure, which treats endometrial ablation or heavy periods. Meg, 15 years ago, we didn't talk about having heavy periods.
Right.
It was just something that women had to deal with. And I just found that outrageous that we had to deal with that. And that's been my connection to women's health. Like, what can we do better so we live a better quality of life?
That's great. I mean, just very clear problem-solving mentality of like not being intimidated by a medical field that you don't necessarily have actual training in, but more just from a human-centered perspective of let's address this. This is a real problem. How can I help?
Absolutely. And can we get rid of the taboos?
Yeah.
When I was a pharma rep, we sold birth control pills, right? And I mean, birth control just became available, was it in the 70s? And you had to be married to get it. Like when I tell my kids these stories, they can't even comprehend it. It's just mind blown.
Absolutely. And how empowering it is to be able to make your own choice.
Yeah, exactly.
I wanted to just talk a little bit about sort of femtech and just that space, that field. We're defining femtech as software and technology companies that address women's biological needs. We did a little bit of, gathering of some data. It looks like in 2019, that space generated about $820 million in global revenue and received just about $592 million in venture capital investment, according to PitchBook. That's pretty small potatoes compared to the med tech space overall, which I think drew $3 billion in venture capital investments in the first half of 2021, according to Mass Device.
Yeah.
What is your perspective on the potential barriers that might be preventing greater investment in femtech solutions, if you see any barriers today? And what might we do to address it, do you think?
I think a couple different things, Meg. I think femtech, digital tech, all your techs are new and not understood. And there's different types, right? There's consumer-based, there's clinician-prescribed, there's reimbursement challenges. So I don't necessarily think it's because it's women's healthcare that it's not getting as well funded. I think it's because it's new and people don't understand. Nor have there been a ton of companies that have been incredibly successful bringing those products to market. So it's the great unknown, which happens to be a space I like to work in. Like we call it the Wild West, because you can create your own destiny. Will I say 98% of the investors I talk to are male? Absolutely. Have they had urinary incontinence? No. Do they like to talk about it with their wife or their kids? Some. But I think appreciating, if your spouse goes through fertility struggles, I think you're there 100%, right? You feel for that. Menopause, kind of lesser understood, I think, for men. But I really think it does come to our obligation as pioneers in this field to understand how it changes the quality of people's lives.
Absolutely. And I do think, I know the app or solution called Clue that's for tracking your periods. I know that there's those types of brands are helping to create greater awareness of women's health issues. Can you maybe talk a little bit more about Renovia and how your aim to address pelvic floor disorders?
Sure.
And maybe even let's unpack what is a pelvic floor disorder, because I think some of our young people may not be aware of it, because as you get older, that becomes more of an issue, but young people probably not so familiar. So describe that, and then we'll get into more of the digital therapeutics.
And Meg, I think what the young people get is that you need a strong core, because they see that all the ab exercises on TikTok.
Yeah. Doing 5 minutes.
Right. Like this whole vacuum thing that they do. But I'm always like fascinated by that, because there's so much conversation on a strong core. and we're talking about flat abs, but your core is really your pelvic floor.
Mm-hmm.
And your pelvic floor supports you. It allows you to walk upright and have flexibility. It gets damaged when you carry a baby for 9 months. It becomes looser as you age, just the effect of gravity. So it's really the cradle in between your sits bones is your pelvic floor, right? And when your pelvic floor, okay, these are muscles you don't see. So this is no one's fault that it's not understood. If you're in the gym doing a plank and you think you're doing it great, and you look over in the mirror and you realize like your shoulders are hunched or
your butt's up in the air. Yeah.
Exactly, right? You can correct that.
Mm-hmm.
When someone tells you to do a Kegel or a pelvic floor muscle exercise, you're sucking in your abs, you're clenching your glutes. It's really hard to isolate those muscles. So what is pelvic floor disorder? It's a lot of different things. It can be urinary incontinence, which means that you leak when you're doing your jumping jacks or going running, or you have to go to the bathroom and you can't make it to the toilet,
mm-hmm. or
you're getting up 3 or 4 times at night in order to go to the bathroom. It can also be fecal incontinence when you're leaking, feces when you don't mean to. It can be some types of sexual dysfunction.
Yep.
So there's a lot in pelvic floor disorders where we're primarily focused right now, where we're selling now, and we have our indication is for urinary incontinence. And, it's women anywhere from age 18 to end of life that suffer from urinary incontinence. It's one of the leading reasons women are admitted into nursing homes.
Oh, wow.
And you think about it, Meg, like you're at Costco and you're buying Depends for your mom. Like it's a $9 billion market for diapers that mask the symptoms. And we as women don't realize that's us if we don't take care of our pelvic floor.
Yes. And when I became aware of it was after having children. And I remember vividly being at a football game and having to go to the bathroom and waiting in the line for the women's bathroom at this football game. The men's room, no line. The women's room, it was wrapped around the stadium practically. And I thought to myself, does no one here realize I've had 2 babies?
That's right.
I'm not going to be able to. This is a disaster. All these, women, I can't believe we're in this situation.
Well, it affects 60% of women. And this is what blows my mind and what draws me to it. So first-line treatment that all your medical societies recommend is what's called pelvic floor muscle therapy, or as you probably read in like Glamour magazine, Kegels.
Yeah.
But women can't do them correctly. So your choice is to go out to pelvic floor therapy, which if you're a mom, a working mom, whatever, that's difficult, like to cut out that time in your day and go there and can be rather intimate. So what Leva really did is we took the best practices of pelvic floor muscle therapy and incorporated it in a way that uses digital technology. So it's kind of like motion sensors in a wand that you insert into your vagina. And the feedback of that is displayed on an app. So it teaches you how to lift your pelvic floor muscles correctly and consistently. And then we have a coaching team that kind of encourages you, tries to understand your goals. But what's really interesting about Leva is that it's prescribed by your clinician, right? So they may remain engaged in your care, and we send them monthly reports to know how you're progressing against your goal. So this isn't something you're going on Amazon for. This is medical technology that just happens to be digital in nature.
Yes. Well, that's great to hear. And I know you guys actually pursued some innovative approaches to figuring out and getting approval, getting the clearance from the FDA for the Leva. Maybe you can describe a little bit about the virtual clinical trials you've done. And, that's amazing.
Well, it's just like COVID for humanity has been incredibly challenging. For the advancement in healthcare, it's been amazing because to me, it just took patients' willingness to engage and clinicians' willingness to engage to a whole new level. As people said, we can have care from home, but find a way for clinicians to still be engaged in it. So we had FDA approval for Leva, but in order to really have the same rigor around our technology as we would expect from any pharmaceutical or medical device, we wanted to do a randomized clinical trial. And in this environment, to have payer acceptance, you need that work as well. So we were about to start a brick and mortar randomized clinical trial. And this is before my time in the company, Meg. So I'm telling their tales. But our medical director, her name is Mandy Pulley. I'm a fantastic urogynecologist. And Robin, who is our clinical affairs person, ready to do this brick and mortar trial, and COVID hit.
Oh my God.
You're not going to bring patients into a hospital facility during COVID for a clinical trial. Like almost all clinical trials, I think, were shut down. Except for COVID related. So knowing that we're digital technology and the whole point is to have your therapy at home, they just recreated the wheel. As we always say, necessity is the mother of invention, right? Like you never see it looking forward, but you see it looking back.
Yeah.
How something happened, in your journey to bring a product to market that was so important and pivotal. You look at it and say, of course, it's a digital technology. It should have been done this way. But the benefit of doing this, Meg, is like we were able to recruit patients from 35 states.
Oh, yeah.
Like usually you do a clinical trial just by the medical universities. We went out on Facebook and said, hey, are you leaking and does it bother you? And people were coming out of the woodwork to participate. Also, the women in the trial were a little bit heavier. Their BMIs were higher than we see in our general patient population. So maybe we got some of those women that were embarrassed to go to their doctor and talk to about it, or more comfortable having treatment at home around their schedule. So I love that about this technology is because, it was a kind of a real life situation. And, we were able to adjust to what was happening in the outside world, but really do it when you look back and say, can people do this at home? Do they have to be overseen in a physical location? Nope.
And I know you weren't at the company at the time, so you may not have the answer to this question, but I'm curious, what do you remember? Did they share the actual pivot? What did that look like, the process to make that shift? How long did it take to go from what would have been an in-person clinical trial to now a virtual one? And did they get the number of people participating as they had hoped? Or more?
Oh, absolutely. The amount of women that we had a shut down enrollment of the trial and actually completed the trial on time, which I think is virtually unheard of happening. So the pivot was very quick, and it really was a funding-driven pivot because we needed to get this clinical trial complete so we could go to not only the clinicians, but the payers with the data that says this really is a fantastic option for women. So, like everything in a startup, high pressure, short timelines, and not a lot of money to do it with.
Awesome. You kind of already addressed this a little bit, but just maybe even describe a little bit of the benefits of digital therapy over traditional drugs or surgery.
Well, I think adherence is better. And that's what our studies show. And when you're doing the leva therapy, it's going to transmit to the app how often you're doing it. You're supposed to do it twice a day for 2.5 minutes. So it's 5 minutes a day of therapy. But like when your dentist asked you if you floss your teeth, do you just remember the days you did it? And it was kind of funny in the clinical trial because we had an arm that was patients doing pelvic floor muscle therapy and the leva arm, and they both reported adherence as part of the clinical trial. So we're checking the adherence in the background. It didn't match up to the patient reported adherence.
Right.
So you go into your doctor and they say, oh, have you been doing your Kegels? And you're like, yes, sir. Right. And then you move down the treatment pathway to more aggressive therapies when hopefully first-line therapy would have worked for you if you were able to be adherent to it.
Yeah.
So I think that's really one of the beauties of it. It's attainable. And you think about if you're a nurse and you're working all day, right? Do you have time to go out to another appointment? You might take your child if they sprain their ankle at soccer practice, but to carve out that time for yourself, 5 minutes a day is all you need.
Fabulous. I was also thinking, I know when you go to do any kind of weightlifting, weight training, they really want to see your posture, the position, the way you do it so that you are not hurting yourself, because that's the other,
that's right.
You don't want to harm. And so that I think is one of the also interesting components of the solution. It sounds like you actually do get that feedback that you're either on track, you're doing it correctly, or you're not. And that sounds very, very helpful.
Yeah, and commonly what women do when they're told to do Kegels or engage their pelvic floors, they bear down.
Mm-hmm.
It's a very common way of doing Kegels that's inappropriate, not good for your pelvic floor. And the app will say, no, stop, take a deep breath, relax. And that's, it's really interesting because when you're seeing the lift of your pelvic floor on the app, you'll see there's like almost a speedometer that lifts up so you can see you're getting stronger, and you hold it for 15 seconds. Mm-hmm. And Meg, when I tell you, you will break out in a cold sweat the first time you do it because you're like, how can I not engage these muscles? This should be so simple. Of course, you get stronger as you go along. But to hold for that full 15 seconds, we have patients that see tremendous results and never were able to hold for the full 15 seconds. So anatomy is very specific to the individual, but we see great results because it is based on your individual anatomy.
Can you share a little bit about the stigma around, obviously, urinary incontinence, nobody wants to talk about it. It's just embarrassing. How do you address it?
That's why we're a prescription-based therapeutic, because I feel like women aren't willing to address it. They need to understand that it's a medical condition and no fault of their own. And under their clinician's care, they can get better. As I mentioned earlier, the American College of Obstetrics and Gynecology and the American Urogyne Society and the American Association of Family Practice all recommend screening for urinary incontinence starting at age 18. So it's not the little ladies about to go into a nursing home. It's 18-year-old ballerinas. And I think the stigma comes from, hey, you're 3.5 years old, you're out of a diaper.
Right.
Do you really want to be back in one? It's embarrassing that you can't control that type of bodily function. And, that's a lot of the education we do in the clinician offices is we have these great video brochures that the healthcare provider will hand the patient that says, okay, this is going to take you through how your pelvic floor actually works, understand how those muscles are engaged. And then, let's talk about a treatment because you don't have to live this way. And I don't know if you ever read, Meg, the book, The Giving Tree.
So beautiful.
I never saw this book until I had my first child. Someone sent it to me as a gift. And this is my take on the book, that a woman gives away her leaves so the child can play and the branches so the child can build a house. And all that's left of her at the end of the book is a stump that the child's sitting on. And sadly, I feel like there's been a lot of conditioning that women give, and don't necessarily take care of themselves. And I've done market research on breast cancer, on cervical cancer, areas like heavy bleeding. The most depressing market research I ever listened to was around urinary incontinence because women were so defeated and didn't think there was any hope. Because what it really comes down to, it's a loss of dignity. And that's hard.
Nothing worse, yeah.
Aging's hard enough, right?
It sure is, let me tell you.
It's only the wisdom that we get.
That's the benefit.
That's the benefit. But it's really, and I don't tell this story often, Meg, but I hope your listeners can take something about it because it's really what drives me in this space. My mother suffered from MS for many years, and she was just such a fighter, right? Like she just wasn't going to let it get to her. She was going to live her quality of life, and she had a really nasty form of it. What broke her was being fully incontinent. It's when she said, I can't do this anymore. And believe me, Meg, she had every right to say, I fought hard enough. I lived a good life. I've seen my grandbabies. But just understanding how of every insult that had been thrown at her with the disease, what was the last straw was not being able to make it to the bathroom or take care of herself after she had accidents. I feel
Thank you for sharing that.
Yeah, it's not an easy thing to share because I want to preserve my mother's memory and dignity, but I think she'd be okay because that's the type of person that she was. But it really is, and I say when I talk to doctors or sales reps or investors, who's your North Star? Who's that person that is the reason you're here? It could be your significant other or your daughter or your whoever that is. Do you want this for them? Do you want them, if they're an athlete running their marathon in diapers or, being at the county fair and working the funnel cake machine and you have to keep running out to go to the bathroom or pushing your grandkids out of the way because you have to get to the bathroom first. Nobody wants that.
Right.
And it's completely in our hands to fix it.
That's wonderful. Yes. What's it been like to see your efforts that you've put so much time and dedication to get it out into the world and make a larger impact?
Meg, every time I say if I'm out doing sales calls and I see thin prep pap test vials, I'm just like, cool. When someone tells me they had NovaSure, not knowing any of my association with it, I'm like, that's right. And, here it's because we have a care management team, right? We have a lot of interaction with their patients. And every day we know that we change the quality of someone's life is a day my head goes to sleep on my pillow, knowing that I did the work that I'm here meant to do. And one of the things that I should probably point out, when we went through my biography, when I worked at SciTech and the jobs I did after that, I had caught lightning in a bottle. We had the right product, the right people, and we were passionate about it. And I felt like I had done really important work. And I had kids at home and I retired. Mm-hmm. And my mom was sick and I wanted to be there for her. And I was really content. I was doing yoga and walking the dog and feeling like I had lived a good life and contributed to society. And I feel like that's really important and why a lot of women are drawn to women's health. If you're going to work all these hours, this madness, let it be for something good. Right? And that's how I always thought about women's health. But, I was in a good place and I got tapped on the shoulder with someone I had worked with for many years. And he said, Eileen, you need to see this. And if not, we say in our company, if not you, who?
Right.
If we won't tackle this, it won't get done. Mm-hmm. And when you're involved in a startup, that's absolutely got to be your mentality, because this is the other analogy I use. We're walking between skyscrapers on a tightrope in high heels with sticks balancing plates. Like we're not any different than any other startup when it comes to that. That's how precarious it is. But I believe we all have this tunnel. We see the future.
Yeah.
Like I say, someone gets a pack of pills and they should have a leva. You should have a leva after every baby you deliver, right? Like this should just be a normal part of women's life, that the pelvic floor is something that gets weak and we need to work and exercise it. It should be as ubiquitous as Pelotons,
right.
At a lower price point. But it just should be start of how we take care of ourselves as women. And we're a company that all really believes that, and you're not going to knock us off our perch.
Yeah, no, and absolutely. I mean, that's the thing. Just as I described my own experience, it was sort of this eye-opening awareness now of a problem that I could be living with for the rest of my life. And I thought to myself, that is totally unacceptable. I cannot believe this has not been addressed more directly or obviously. So thank you for this product. There's just so much about it that is very, very cool. We're excited to see where it goes, and we want you to have the great success. Maybe we can talk a little bit about some of the failures you might have experienced or risks that you've taken that just didn't, pan out, and what you learned from that experience.
And Meg, this might be part of I am an eternal optimist, that I look at anything that didn't work out and it's a pivot, right? It's just like, okay, we did our research. We thought that was the right thing to do and it didn't pan out. Maybe we were just too early or maybe we were too late. I get the question all the time, why aren't we doing more direct to consumer? And I just say, because women aren't searching. They don't Google search for urinary incontinence or leaking. This is something that clinicians need to educate patients about. Women aren't necessarily willing to share their journey. I hope we can normalize that conversation and change the narrative. Like, yeah, you have a baby, you might leak. Hopefully you'll recover. If not, there's leva for you. You're going through menopause, or you're having problems with urinary or you're leaking when you don't want to, or do you have to go all the time?
Right.
Can you not make it to the toilet? There's something that we can do for that. You can take care of it at home on your convenience. And as soon as 4 weeks, you're going to see significant improvement without easy to access treatment. I mean, I think people know about sling surgery that you can have for your bladder if you have
sort of,
stress incontinence.
Only because I know somebody that had it, but I wouldn't have known about it.
Meg, I have to tell you, I was on the Peloton, I think it was Women in Business Facebook page, and someone posted a picture of themselves coming out of surgery, bladder surgery. And within 24 hours, there was 300 comments on, I didn't know there was anything I could do.
Yeah.
That's why I got this, because I couldn't run anymore. Oh, I don't have to take these medications. I was just like, wow, we have so much education to do.
Yeah.
I got off your track about failures, but I was brought up in an environment Gene Kranz, now I'm dating myself, right, with Apollo 13, that failure is not an option. Failure is only an option if you give up or you don't make a change based on it. So when it's something as important as this, 60% of women experience urinary incontinence, like 60%, right? 78 million women, according to the latest papers. How do we not, as a society, address that?
Right. Absolutely. Who are some of your biggest influencers or mentors?
And I know this is a woman in leadership show, and I'm supposed to probably mention women, but I have
you don't have to at all. Nope.
I mean, Meg, I came up a long time ago, and the people that were above me were men, and I had great mentors. And I think it's age and stage, right? Like I worked in startups, and every person needs to contribute, and they need to be able to contribute outside their lane, right? It's always a new challenge, and hey, I need someone to take that on. And I was just given the flexibility, right? Raise your hand, go get it, figure it out. And that was so empowering to me. Yeah. So that's what I've taken away from mentors. I can say I walked beside some really fantastic women. I worked with Shacey Petrovic, who's the CEO of Insulet, and what a great job they've done in the diabetes space. I worked with an ad agency that, she was just baller. I don't know what else to say to her about her. You know what I mean? Like just the way she approached work and the way she commanded a room. But, as a working mom, I didn't grow up in business seeing other women like me.
Yeah, I was just going to say, like you just described two women. What was it about them? The one who was so confident in front of the room and sort of declaring what they wanted to achieve, that style, that personality attracted you. What was it about it? And where did you find your own confidence?
Well, she knew her stuff, right? And the confidence that came from that. And nobody knew the business she was addressing better than she did. And I really appreciated that. My background is commercial, even though I'm a CEO, and I'm very customer focused. And our customers are patients and clinicians. I like to spend a lot of time with them, chat with them, understand where they're coming from. Nobody should know my business better than me, not meaning I know every aspect of the business. I have someone who runs my product development and operations who's a double MIT degree.
Great. Yeah.
More props to you, Julia.
Make sure your team is smarter than you. Yeah.
Right. And you got to complement each other. You don't want 10 people that have the same core strengths, right? You need to have all the different offerings, all the different styles. And I think about our team, and we all talk differently, act differently, think differently, but our values are the same. We think women should have better options. And that's where we come together, right? And that's where we keep focused on. I take things from people I see every day, whether it's an analogy on how they phrase something or it's a viewpoint. I love different viewpoints, right? I like being the boss because at the end of the day, when I heard all the viewpoints, I get to make the decision.
Yeah.
But I love it when someone challenges me and I think about things differently. Like that's what brings me out of retirement and helping women is that you can get me to go to a large Fortune 500 company, not for all the tea in China, because what's appealing about that? Like I like my small group, as Margaret Mead said, small group of committed people that are going to change the world.
You guys are a woman-led organization. So can you describe what that is like? How is it that having a group of women at the top is different maybe from other experiences you've had?
We're extremely productive.
Yeah.
And, virtual plays into that too, because we're an all virtual company. I didn't see the people I worked with for the first 6 months because it was deep in the heart of COVID. I think it's stage dependent too, Meg, right? Because we're small and people have to wear multiple hats. We talk things through.
Yeah. And is there maybe a culture, like something that women leadership creates a certain kind of culture in an organization? Or not necessarily, it's just unique to the specific women that you actually collaborate with?
I think the virtual work environment is the best thing that ever happened to moms in the workforce. And I'll say our dads too. Like you hear in the background of a Zoom call, someone's going to pick up their kids from soccer or, football practice. I also know that from that person, I get a dump of information at 10 o'clock at night.
Yeah.
because he made up those hours. Are women leaders more attuned to that because they've been doing that juggle more of their career? I don't know. It's certainly the environment that we work in now.
Mm-hmm, mm-hmm. Yeah, it is. It's so amazing. Our team has been a virtual team all throughout our history of a company. And so it's really interesting to then see our clients shift to becoming a virtual environment and the reality of their lives intruding on their work more than they maybe had hoped. And that how human it is to see that, and how, we let our hair down a little bit more, which just makes it all more easier to interact and connect.
Well, authentic leadership.
Right.
Right. When they see who you really are. I actually think employers get more out of people when they're working from home because there's not that fine line, and it's easier to be on Zoom calls and hop out and make dinner and hop back in. My kitchen's right there.
Yeah, exactly. Well, exactly. I mean, it's the blessing and the burden,
Right.
Because it's true. I noticed that, you can basically start working really early and then keep going. And so that's the problem. It's sort of making yourself step away, close the computer, get back to your family or your life and, create some more boundaries.
And how much they just intertwine, right? Hey, I know when my daughter, I have a senior in high school, when I get the 10 minutes that she wants to engage with me, I know that phone needs to be down.
Right.
I need to connect one-on-one, but to be able to pick back up. And I think the challenge for companies is how do you keep the working hours when you need to be together?
Right.
But allow
consistent.
People, yeah.
Right. So that you're all actually able to connect live together in a way that everyone's on the same page, and then adapt to everybody's unique schedules depending on where they are. I also have high school daughters. And so one of them is a junior. Do you have any words of wisdom for the next generation who might be considering a career in healthcare?
I think it's the most rewarding and fulfillment business that you can be in because it combines the best of everything. You're doing great things for the world in general, so you can feel good about your contribution. It's got intrigue, right? Like what's the new technology that's coming out? Challenge of having investors that are supportive, and it's everything, right? It's like you're dealing with a government. It just combines a little bit of everything. So I think no matter, think of all the analysis that's going on in the healthcare field, like how we're understanding each individual, and we're just feeding incredible amounts of data to predict outcomes.
Yes.
Whatever your skill set is, I just feel like in healthcare, it can be used for good, which is what I love about it. Nothing against any other profession out there.
Of course.
Is just the one that I connected to and have enjoyed for too many years than I care to count now. I think I'm going to do this and then maybe take a longer sabbatical next time.
Yeah. Have you guys been out raising funds? Is this something you guys are doing right now? What's that been like for you?
There's a term they use from the movies in selling, that ABC, always be closing.
Yes.
It's same in a startup.
Yep.
Yeah, you're always fundraising, making sure, because hey, once you hit one milestone, then the next milestone is going to need more money. And we have our pivotal trial done, and we have a co-promotion, but we really wanted to put our own sales force behind that effort. And you see their success, and you just want to do more, right?
Yeah.
You want more salespeople out there. We're starting our conversations with payers for reimbursement, right? So that takes fundraising to have the experts in there to do that. So it's just the more successful you are, the faster you can go and the more money you need to do it.
Yes. Okay.
So it's a good thing.
Yeah, absolutely. And what has that been like just to speak to investors? Have you noticed anything? Like, are you speaking to women investors primarily, or are you hitting it across the board? And have they noticed anything about those two different groups?
It's really interesting, Meg, because I think of what we are. We're not what medtech investors would invest in because there's the digital component, and we're not necessarily femtech because a lot of that is direct to patient conduit.
Oh, right.
Yeah. So we don't really fit into any specific investor class or what they're really comfortable with. So yeah, we do have a lot of conversations. I would say 95% of the people we talk to are men. I mean, really educated, smart as whips. But sometimes when you're investing, you're placing a bet. right? Especially when it's a brand new technology on a journey that hasn't been done before. So are you going to place that bet in a space that you're more comfortable and understand more about? To me, as a female, it's like, this is such a white space. Women need this help. It's not a bet because
it's clear.
Understand this. It's clear. But it's those conversations. We have a fantastic group of investors that have been with the company for quite some time now and have been really lucky.
That is great. Yeah. And hopefully you don't need to spend too much time defining and educating investors on what your offer is and what your product is. But it sounds like, there still is some of that groundwork that needs to be laid.
And the beautiful thing about, we've been selling to OBGYNs for the past year now. Now I can just say, just call a couple OBGYNs, right? It's so much better to come out of their mouth than it is from mine to understand the impact it has on their practice. I think that's the comfort they need and what they need to hear.
Mm-hmm. Do you guys have an advisory board as part of your organization?
Well, we have like a medical advisory board that Mandy, our CMO, uses when she's putting together clinical trials. And then we have more of a corporate advisory board. So lots of different, and people are just wonderful, generous with their time, right? We have a lot of clinicians that are like, I've been waiting for something like this.
Yes.
And just freely will share their thoughts and expertise and how it's impacting their patients with us.
Stepping back, we're just going to pull the lens away from healthcare for a moment. Just what are some other things in your life or areas of interest that aren't necessarily related to your work that you think make you who you are and influence how you work?
I think make no bones about it. If you want to be successful in a startup, you eat, sleep, and breathe it. Mm-hmm. And I'm in a fortunate phase of my life. My husband's retired, so now he does the Target and Costco and Public runs and I just about cook dinner. I only have one left at home and she's pretty independent. Mm-hmm. So I happen to be at a time that I can. I mean, I go to sleep thinking about work. I dream about work and my feet hit the floor. I'm working. Mm-hmm. And I know that. And when I retired or took my sabbatical, however you want to look at it, to come back in, I did not do lightly. And it was a family meeting, like, I'm not going to be there for everything because I don't want to say women can have it all because it's really hard to have it all at the same time. And you better be really careful when you decide to start a family that you talk to some women, know how they do it. I had 9 au pairs. Right?
Oh, yeah.
My girls were raised by, and I have a son, he's 10 years older, but my girls were raised by au pairs and it had such a fantastic influence on their life, right? So did I feel guilty about it at times? Heck yes. But was it, did it make them into the strong, confident women they are today? Then 18-year-old from another country who didn't speak English as their first language can come over here and do everything they did and learn everything they did. Mm-hmm. That's an amazing experience. Is it the way I was raised? Heck no. Did my mom give me grief about every moment of my life for pursuing a career? Yes, she did.
So funny. It's so strange, right? Because she wants you to be happy, but then to challenge the fact that you're pursuing a career. It's interesting, isn't it?
Well, you think about these, I'm sure daughters are the same way, super smart kids who are so dedicated to their schoolwork and have such ability to achieve great things. Let's hope society balances it so they can. And I look at my son and you couldn't find a more supportive husband, right? And I'm like, gosh, I hope my girls are so lucky.
Right. No, I agree. And I remember thinking too, because I had a little chapter, short chapter where I wasn't working very much. And I thought to myself, actually, it's really important for me as a mom of daughters that I want them to see me working and doing something I'm really interested in and that I care about and that I'm, have my own life outside of them. Actually, that was another important message I wanted them to see. Like, you guys are important, but you're not everything. And it's a strange message.
Meg,
because I love them,
so
of course.
True. Mm-hmm. So true. Mm-hmm. You don't want them to be the giving tree, right? They got to be fertilizing.
Yeah.
It's so true.
Mm-hmm. Mm-hmm. So what do you hope to tackle next, if anything? I know you're newly into this role, so it may not be really, this is what you're tackling. Growing this business.
like I said earlier, like a pack of pills and a leva. Like that is my vision for the future, that this is just part of women's health as they journey throughout their life.
Mm-hmm.
And I believe in destiny, right? And when I was on my sabbatical and I retired, I was very open to, if the right thing comes in front of me, I'll look at it. Like you never say no. But how lucky have I been to have the right people, the right product, and such a passionate group. Twice in my career. I don't know, Meg, maybe I'll just like travel to Tuscany and do some yoga and walk my dog and know that, you know, I'll help women fight cervical cancer, and they don't have to have heavy periods if they don't want to deal with that. And gosh, I'd like to put Depends out of business.
Yeah. We're just thrilled to have this opportunity to learn more about your path, the product you've launched, and the unique approach that you've taken to get it approved. And thrilled to have this chance to talk with you. Thanks, Eileen.
I've really enjoyed it, Meg. And thank you for having me on. I appreciate it. Hopefully we'll get some more women some help.
Thanks for joining us for the Game-Changing Women of Healthcare, a production of the Krinsky Company. Today's episode was produced by Calvin Marty, Chelsea Ho, Wendy Nielsen, and me, Meg Escobosa. This podcast is engineered, edited, mixed, and scored by Calvin Marty. If you enjoyed the show, please consider leaving a rating and review wherever you get your podcasts. It really does make a difference. And share the show with your friends and colleagues. If you have any questions, comments, or guest suggestions, please email me at meg@thekrinskyco.com. And you can visit us on the web at thekrinskyco.com. See you next time.